It's just kind of a testament to when some kind of chaotic moment happens, that's the moment that you have the greatest opportunity to create change and to do something wonderful.
There were so many unknowns, and so I think when there's unknowns, I know in my life I want to find something that is a known or is a stable. And as important it was for us to follow the guidelines from the government, both local and federal, as far as distancing, etc., we still had to find something that was normal, if you will.
In March of 2020, COVID-19 came to East Tennessee, and our communities and nonprofits took a major hit. In the midst of the chaos of the pandemic, we saw East Tennesseans rise to help their hurting neighbors.
Well, I think the initial impacts were the remote status, the shutdown, and ultimately the workforce going home. Are we prepared from an infrastructure standpoint? Do we have the tools necessary to continue the work? And then ultimately the next step was, how do we then stay connected with the people that we serve, the people that donate, the people that volunteer? How do we keep those lines of engagement open?
There are multiple layers of impact. Of course, the one that we're most concerned about is the people we serve. If we don't have the resources that we need to keep our organizations up and running, then the people who are homeless, the people who depend on us for food security, the people who have intellectual disabilities, the youth and children whose parents are trying to find a way to go back to work and need a healthy place for their kids to be, those who support the work of our public schools, all of those who work with animals, those in the arts and culture community. I could go on and on. The big impact of the COVID is not on the nonprofits, it's on the people who the nonprofits serve.
We know COVID-19 crime has increased nationally substantially due to COVID-19, and our community is no stranger to that. We have seen an increase in violence in our communities. So when you have populations that cannot function in a normal setting, you're confined inside, and you're already living in poverty, and there's the anger, the frustration that goes along with that just exacerbates that. And so for a lot of people in the African American community, it's brought on even more trauma.
As we think about people in our community and COVID-19 and its impact on their mental health and associated conditions, frankly, it's really about stress. I mean, the difficulty for our community is being under duress or stress for an extended period of time. That creates a lot of anxiety, and for some people that creates depression.
We were first responders. How are we going to do this? Everything had to be adjusted. Everything that we had ever done in the 30 plus years Second Harvest has been in East Tennessee had to be restructured. And some of our partners weren't open. How do we get the food to that community? It was complete panic.
It's easy now for me to say, well, on the onset of COVID, we immediately recognized that it was going to be a marathon, not a sprint. That is not the truth. We all thought that it would be over fairly quickly. We believed in some cases what we were told by our leaders, and I did not think that this far into the year, into the fall, my office would still be closed for safety reasons, and our nonprofit partners with whom we partner and through whom we do our work would still be beset by crisis after crisis.
I was scared when COVID-19 first came out. The first thing I did was went and bought a bunch of canned food, right? And put it in my basement. And I think that's kind of everyone's first thought, is that of your own survival. And it's really easy to get lost in that and get really, really worried about yourself. And then something might happen, you start thinking more about your community, right? And that if me, someone who's, well enough off, is in a panic state, right? How are people that maybe don't know where their next meal's from feeling? And so I think it's just fear. I was afraid, and I was afraid for other people too.
Those of us in the nonprofit community found all of our tried and true traditional ways of raising money come to an abrupt halt. As a fundraiser, I can tell you the most important thing we can do is involve our donors in our ministries and in our missions, and yet with COVID, face-to-face personal involvement wasn't possible any longer.
So fundraising was devastating. Really, it was a perfect storm of challenges for the nonprofit sector. What I mean by perfect storm is the needs that our nonprofit community serves, whether it's childcare, whether it's food access, whether it's affordable health care or stable housing, the needs increased. And so there was a much higher desire for the services we were providing. Simultaneously, from a fundraising perspective, our ability to raise money was going down. So you had this perfect storm of challenge.
We were very fortunate that the federal government passed the Paycheck Protection Program early on, and we were able to, as a community, we were able to get quite a bit of money through the PPP, enough to sustain us to get us through the first half of the year. In the fourth quarter, we're starting now, and we'll see how it goes, but we anticipate we'll have losses. And then in the first quarter of next year, I think the tale will be told as we look at how many nonprofits are able to survive.
There's really no norm, but it's easy to say now that clearly what we are working through with this pandemic crisis, nothing is what we expected, nothing is normal. We're our region's community foundation, so we're in the grant-making business, and we have nonprofit partners in all 25 counties of East Tennessee. All 25 counties, each of them has experienced the COVID pandemic and just the emergencies that has caused. They've all experienced it a different way. So we have to interpret that. We have to help them discuss and discern what their needs are, what is most immediate, what will help them accomplish their mission, and what will it take to help preserve them or ensure their survival through this crisis.
With the national climate that we're experiencing right now, I can't say that I hope for us to go back to normal, because for African American and Black people, normal still was not a good way of life when we look at it from that lens. And so what I want to see going forward is that we get to a place where all people are viewed and treated equally.
We wrestled early on with how to ensure that people could have access to care. And for us, that meant adapting our delivery system from face-to-face encounters with people through televideo or telephonic transmission, and try to meet them where they are in their home or various other places.
What COVID brought was the realization that your neighbor who had a great job, who provided food for his family, overnight lost his job. And so those who needed Second Harvest prior to were still there, but those that never thought in a million years they would ever need Second Harvest and never need our partners had needs that we had to meet. There's still going to be a need for Second Harvest when we get through this. And it's going to be a long time before we get through this. We still keep hearing about businesses, major businesses closing, who had hundreds of employees, who are still struggling with where they're going to work, how they're going to get another job, all the stuff that impacts feeding your family.
Throughout all these challenges, there were extraordinary stories of people volunteering in unique ways to help, and that's what this program is about. It's a sampling of just a few of the stories of everyday neighbors doing something extraordinary to help others, while the world around us just seemed to shut down. Normally, at this time of year, AFP celebrates National Philanthropy Day and honors extraordinary donors who have made an impact over the last year. Obviously, we aren't hosting our typical in-person event this year, but we thought it was more important than ever that we pause and look back at the amazing impact our nonprofit sector has had and the special people who stepped up in exceptional ways to help their neighbors.
And for me, I went out and started playing the bagpipes outside my house, right? Just kind of as a way for me to cope. And then one day I got a call from one of my neighbors, I think it was, and they said they could hear me and that it was cheering them up. So I said, you know what, I'm just gonna go walk around the neighborhood and play. So I did. I started in Holston Hills, my neighborhood, and then the next day I was asked if I would go to Sequoia Hills, and I did. And I wasn't raising any money back then or anything. It was just for fun, right? And people were coming out and they were cheering and they were bringing their kids outside. And yeah, it was like wherever you went, everything's black and white before, and then it's, you're in Technicolor afterward, right? It's really putting life into these neighborhoods. And then I remembered how the previous day my wife had told me about Second Harvest and the trouble that they were in. And so I said, you know what? That's exactly what I'm going to do. We'll make it for Second Harvest. And at that point, I hadn't even talked to Second Harvest about it. I just said, okay, I'm just going to start raising money for them. And eventually, I was able to get in contact, and they were happy with it and whatnot. So we proceeded.
Well, that was the most beautiful thing about what we experienced every day, was seeing the effort people like Tyler gave Second Harvest. It was amazing that someone who knew Second Harvest might be in need would take the additional steps and the incredible effort and hard work he took just to help Second Harvest. And one of the things that we relied on so much was those opportunities of just complete hope, not just for Second Harvest, but for the community.
Seeing people wanting to give money to Second Harvest, and then having kind of that second thought for just a second about, what if I lose my job maybe, right? And it's just that fear of the unknown that really is that kind of negative driver. But I think that it also brings out the best in people as well, right? I would say out of the 10 people that I asked for money as I'm walking down the street, 9 give.
We really made the change. I can't forget. I'll never forget. Keener sent me a text. It was on a Thursday. He's like, we ought to throw some hand sanitizer out. There's some people asking, or not asking, but talking about shortages. I'm like, well, do we have a formula? We had a WHO and an FDA approved formula, which was different than what you would get from a Purell or something like along those lines. So those are going to be a lot more gel-based. It's going to be a little more solid, etc. So ours is it's liquid. Is what it is. So it's really simple. In fact, it's 100 times easier than making whiskey because you're putting exact ratios into 3 ingredients and mixing them, and that's it. So we provided stuff to the school system, area hospitals, both Blunt Memorial as well as LeConte Medical Center, Covenant Health, Helen Ross McNabb Center, Boys and Girls Club, the school systems, even recently another round to the school systems. The point definitely is that whether it was a non-for-profit or whether it was Quality Plumbing or Cherokee Group or these businesses that were considered essential needs, we were able to provide for that.
Old Forest Distillery has been a long-term partner of the McNabb Center, and we have benefited during this COVID-19 by their generosity once again. They made hand sanitizer specifically during this period of time that we needed. We couldn't get it, the supply chain was not up and ready, and to have hand sanitizer provided to us in large quantities allowed us to distribute that throughout our sites across East Tennessee. And it made us safer, and it made our patients safer, and we're very grateful for that help.
Distilleries and breweries and local restaurants, they're that fiber of that community, and they provide what that community needs at the time the community needs it. All we did is adapt to a different need for that community. We're the same business. We're still a distillery. We still want to be we still want to be the best dang, moonshine and whiskey place in the state, but our community needs something different. So although it was a different process, it's still in the core was the same. We're center of the community.
Ours is funny because it started out as me seeing my friend Betsy's masks on Facebook, and I'm going, those look really nice. Where do I get one? Obviously, I'm going to need one. And I called her, and she started telling me that they were trying to get masks for one of the assisted livings, where a friend of ours was a nurse practitioner. And so I called her and called somebody else, and we started grouping things together and supplied to one assisted living and then another. And I thought it was just going to be that. I had no idea. And so right from the get-go, we decided this was going to be for people to help people who could not help themselves necessarily. And doing that through United Way and saying to Naomi over in Oak Ridge, what do you need? What do your different groups need? What do you know? How many people are you feeding at the church? And we would hand off and she would distribute. So it was always, let's get it to the people who cannot get it for themselves. And so through Ecumenical Storehouse, they were grateful. Free medical clinic. I can't even begin to remember all the groups we've given it to.
I think the number is 90,000 masks that we have given away to nonprofits and worthy organizations. So we've tried to respond in every way we possibly can. We've given $225,000 to 4 different nonprofits that we thought were really in need, and we will continue to do that. Well, obviously there were tremendous concerns about the economic issues, businesses that obviously either had to close or were operating on a limited basis. There were concerns about the nonprofits. There were concerns about schools, universities, high schools, all schools, K through 12. And to be honest with you, it's been going on almost 7 months now. I think our community has done very well in rallying. We've tried to help out all the nonprofits. There have been some governmental programs. United Way has done a yeoman job. So I think our community has responded to this crisis. We have a culture here at Pilot and in our family of giving back. Read Luke, to whom much is given. It doesn't say much is expected, it says much is required. And our company and our family will continue to give back to the best of our abilities. So these things have happened. We will survive all this. We'll be a better country for it.
So 3 of us kind of had the same idea, and then we started working together, and we're just constant brainstorming. And it was super exciting at first, so I kind of put all of my time into it and was completely ignoring school for the first month or so before we could actually get it going. And then once we were able to get, start raising money, then it was an issue of trying to find somewhere reliable that we could purchase the PPE and putting in the food orders and just making sure that we were using all the proper channels to pay for all of that and making sure we're doing things right. So our initial fundraising goal was $1,000, and we surpassed that within the first day. And then so we raised it to $5,000, and it didn't take us that long to get to that point. Our faculty helped us out at the beginning with spreading the word and also raising funds for us. They actually donated a significant amount in the beginning. And then we reached out to our family, our friends, and then to kind of broaden our reach, we made some shirts, and we tried to keep coming up with new designs every so often to just provide more options. And I think initially we wanted to make shirts for other medical students or other students.
Helping out wherever you might see a need, and being also kind of conscious and responsible with the decisions that you make with limiting the spread of this disease. And then also I think kind of acknowledging that the pandemic has not affected everybody equally, and that it's okay if you can't do anything or if there's limits to what you can do, because it's a really difficult time.
I think throughout living in a pandemic, we've really seen a bunch of the community come together, and that was really powerful, just to see people help each other out and people come together as a community.
Knoxville is one of 7 BOGO communities that we launched in 2015 as part of the effort to improve health in our communities and support making health easier. Part of our funds were dedicated to supporting the capacity building of local organizations. And so we decided to work with 24 community foundations across our footprint. East Tennessee Foundation was one of those partners that we wanted to develop. And so we created a partnership with them, gave them a grant of $500,000, and really let them decide where the money was best deployed.
When we knew that COVID was going to cause some issues for us in our programming this summer, we started brainstorming about if we could provide camp, what that would look like, what the benefits and risks were. If we couldn't, what the benefits and risks were. And we really, our main concerns were a lot of our children live with older adults, grandparents, great-grandparents who are more at risk. They live typically in areas where they don't have adequate health care. And so if they were to get sick, that would be a problem. There's a lot more pre-existing conditions that can exacerbate COVID-19. We're also concerned about mental health. Our campers, not all of them, but some of our campers are in difficult situations where it's not necessarily a positive to have a lot more time to spend at home, whether that's just because their parents are working a lot, or they're helping to care for their own siblings and helping to raise them. But we were concerned about that as well. The parents are working, and that's a necessity. Caring for their children is also a necessity. So would us not being there and providing camp cause issues for them? So we were thinking through all of those things and how could we still show our campers and their families that they're loved and valued, and send a little bit of hope during a time that maybe felt a little bit hopeless. This summer we were able to serve over 1,400 children through this program. That's several hundred more than we have ever served in a single summer. We were able to double the number of partners that we worked with. In spite of the pandemic, we have really seen people step up to care for people in unique ways, and that's been really helpful because we've seen a huge increase in the needs that people have as well.
Going forward, at AFP, our members' hope is that cynicism and anger is now replaced with optimism and unity as we continue to work to bring out the best in all of our communities.
I have a hope that people begin to recognize that, and philanthropy and and its power and importance in changing people's lives is recognized, appreciated, and then going forward, it's strengthened because philanthropy has been able to respond most quickly, most efficiently, and most successfully.
Days like today are built for communities like Knoxville. I believe that it is in times of challenge that people of great character and communities of great soul rise up. And I believe we're seeing that, and I believe we'll continue to see that. And I believe on the other side of that, we will see the results of a great community rising up during a difficult time.
At the McNabb Center, I believe our hope for the future on post-COVID-19 is that we'll be a stronger community, that we've learned to lean on each other during this time, and that because of our collaboration, we've done better by the people in this community, and I think we'll have all shared in that success.
What gives me hope for the future are people like Tyler who recognized that there was a need, did something physically about it or emotionally about it, but also that people would say, I don't want my neighbor to go hungry. I don't want my neighbor's children to suffer because this thing hit us, this tragedy hit us, and we couldn't control it. So that kind of compassion, that keeps me going.
Helping people out as well as you can, and everybody to their own skills. You know, to me, if you've got vast amounts of money, you do that. You know, if you don't and you can sew, you do that. If you can cook, you go cook. But I've been so distressed by the amount of people I've seen in need and listening to how much is needed and how much food is needed, that for myself, I would keep going into my pantry and I'm going, I don't need all of this canned stuff that I bought initially here. And I would turn it over to United Way. This doesn't mean I'm rich. It just means I'm lucky I got enough food on the table. It's fine. Other people need things, so you do.
So I have something that I can give that someone might not be able to give themselves. But they also have something that they can give as well. So recognizing what gifts you have, whether that's money or time or wisdom or whatever you have, and finding a way to give those things, but then also recognizing that the people you're giving to also have gifts that we need to recognize and see in them.
For me, philanthropy is doing whatever I can do when called upon, but also when I'm driven to do it, if I see a difference or if I see something that needs to have a difference made.
It's about giving back, not just out of your own pocket, but out of your own work, out of your own spirit, and out of your own desire to do good, right? And it's amazing that when you've got a passion for something and you share that passion with other people and you have a desire to do a greater good, people will help you achieve that.